Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along. We're also happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. We are also glad to have you as the media and listeners and viewers in attendance today. For our friends in the media, just a reminder that if you have questions, you can submit them here on Microsoft Teams. Just click on the text bubble with the question mark, indicating your name as well as your media outlet and who your question is for. And finally, a welcome to listeners on Global News Radio 980 CFPL, viewers on Rogers Television, as well as the Rogers Facebook page and YouTube channel, and those who are tuning in this afternoon on the CTV London website. Let's get to the opening remarks right away, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. Well, the news looks exceptionally uplifting no matter which metric you use and consider where COVID is impacted, both locally and provincially. In London Middlesex, we've had less than 25 cases for 4 of the last 5 days. And as recently as a couple of weeks ago, if you remember, we were 3 to 4 times that number. So the progress is truly remarkable. And it's becoming increasingly apparent that across Ontario, we're near a tipping point where the economy will begin reopening. And I suspect that's going to start to happen sooner rather than later. The Premier himself said as much during his remarks yesterday. And like everyone, of course, I'm anxiously awaiting further updates on that front. Ultimately, however, that's not something we can control. What we can control are the choices we make in the meantime, and especially as things begin to open up. As we've said, and this is something that is totally in our control. Wear our masks, physically distance, wash our hands, and avoid indoor gatherings. And more than anything, get our vaccine. If you already got the shot, tell your family and friends how easy it was, how painless it was, and encourage them to do the same. When vaccination rates go up, case counts and deaths come down. It's as simple as that. On a more somber note, too, I'd like to take a moment to acknowledge a sacred fire inside a teepee set up by the Atlosa Family Healing Services in Harris Park. This ceremonial space provides people with a chance to grieve the discovery of the remains of 215 Indigenous children at the Kamloops Residential School. This is so appropriate and so very much needed at this time of deep pain and, frankly, great suffering. The fact that it's outdoors and provides people with a safe space to gather is important. Given our current restrictions, without this space, it's possible some people might not have that chance to properly grieve and come together. I plan on visiting the site later this afternoon to express my private condolences, and I'd encourage others to do the same as and whenever you are able. So that's it for me today, and over to you, Dr. Mackie.
Thanks very much, Mr. Mayor. So a tremendously positive day from the perspective of our local COVID numbers. Just 18 cases reported yesterday. Wednesday is typically the peak of our case counts for the week. So 18 cases, no fatalities. Things are very much trending in the right direction. You know, the one thing that I think is important to remember is that coronaviruses are seasonal illnesses. And so part of what you're seeing now is the same thing that we saw, last May, June, with cases really dying off in part because of the weather. The other aspect is that, we will have more waves and cases of COVID if we're not careful now and if we don't get vaccinated over the next few months. So we really do need everyone to continue to keep their distance, follow the provincial guidelines. We see the stage 1, 2, 3 reopening over the next few months being totally appropriate and safe. And if people can keep to those guidelines, we shouldn't see another wave, at least before the fall. And then it is all about rolling up the sleeves. We've seen good uptake, something in the range of 15 to 20,000 of our youth aged 12 to 17 have got appointments at this point. We're looking forward to getting those needles into arms, getting those people protected with the first doses. And as you're seeing, opening up for second doses and earlier rebooking of second doses over the next few weeks as well. At this point, we are seeing appointment availability opening up in the London and Middlesex area. That means we will stay on track to open to rebooking for folks that are 80 plus as of Monday. It looks like there may be some announcements at the provincial level about rebooking others earlier. So, we'll look at that announcement when it comes out. But at this point, we're planning to rebook earlier appointments for 80 plus as of Monday, and that'll be, again, primarily through the website as it was with the booking of the first doses. Dan, I'm going to pause there. Happy to take any questions.
Thank you, Dr. Mackie, and thank you, Mayor Holder. We do have several questions already in line, and let's get to those right away. Jennifer Beeman is first from the London Free Press this afternoon. Dr. Mackie, there was a report. The province is considering abandoning the age band rollout for second dose bookings and just letting anyone who wants an earlier appointment book. How disastrous would this be for the London rollout?
Well, we're not through our first doses at this point, and we're still looking to get additional people booked into first doses. So we're not ready to move towards anyone being able to rebook their second doses earlier at this point. I see that happening sometime over the next month or so, but we have the advantage of being in a separate booking system here in London and Middlesex, which means we can adjust eligibility for the needs of our local community. And we'll certainly be doing that. We're not going to rush to rebook everybody with their second doses earlier until we're sure we've got as many first doses in arms as we can, or at least people have had the opportunity to book those. So still focusing on first doses. We will be rebooking second doses for 80 plus as of Monday, and then others as we're able to after that.
Thank you, Dr. Mackie. Let's go to our next question, and it's a follow-up from Jennifer Beeman. Dr. Mackie, how many doses of Pfizer is the London area receiving next week and the week after? How about Moderna deliveries coming up?
Yeah, so this week we did receive a bit of an additional allotment, about 2,000 doses. So overall this week we received about 27,000 doses of Pfizer in the region. Moderna numbers are very small. We had about 1,000 come in for primary care. We had about 1,000 come in for the Middlesex-London paramedic service to help with some of that outreach work using a mobile clinic approach and some vaccination for people that are homebound. Other than that, we don't have a lot of clarity about Moderna. We've heard there are big numbers coming into the country. Those haven't been allocated out at the health unit level yet.
Dr. Mackie, let's go to our next question, and it's one more from Jennifer Beeman. Dr. Mackie, now that Ontario has cleared pairing AstraZeneca first doses with Pfizer or Moderna second doses, which second dose vaccine is preferred? What should people who received an AstraZeneca first dose do?
Yeah, so really people who received AstraZeneca as a first dose are in the fortunate position of being able to, choose AstraZeneca, Pfizer, or Moderna. All of those now have been supported by the federal level and at the provincial level for second doses for AstraZeneca. So that's a great thing. The people who received AstraZeneca should go back to their original provider, whether it's a pharmacy or primary care, family doc. They need to try and get their vaccine first through that original provider. And at this point, we don't have a process in the provincial vaccine tracking system to give people second doses of a different vaccine. I understand the province is working on the back end of that software so that it will allow that, but at this point we can't give a second dose of a different vaccine in the mass clinics.
Thank you, Dr. Mackie. Next question comes from James Sims at the London Free Press, and Dr. Mackie, this one is for you as well. Dr. Mackie, the Ministry of Health sent out new guidelines today for long-term care visits. They include allowing fully immunized residents to leave their long-term care homes for day and overnight trips, letting people go inside the homes to visit loved ones who can't meet outdoors, and allowing brief hugs regardless of vaccination status. Can you make a comment on these changes? Are they a long time coming, or is it too soon?
Thanks for the question, Jane. I think it's just about right. I think it's just about the right time for people who are fully vaccinated in long-term care homes to have more flexibility in terms of traveling outside of the home, giving hugs, as you say. These sorts of things we've seen just excellent vaccine coverage in long-term care homes, certainly of residents, and we've seen excellent results of the vaccine campaign in long-term care homes, really seeing cases trail off to, near zero, and the death count plummeting in those facilities. So I think it is the right time to see more flexibility in that setting.
Let's go to our next question, and it is from Daryl Newcomb at CTV London. Dr. Mackie, will people who received AstraZeneca in Middlesex-London be able to book second doses of mRNA vaccines through the local health unit? We talked about that. The rest of Daryl's question, though, given the number of Delta variants in the GTA, do you still feel that Middlesex-London Health should be pushing for the 20,000 doses that this region has seen redirected to hotspots? And thirdly, yesterday, the Premier suggesting step one of reopening might start before June 14th. Do you feel an earlier start to reopening is appropriate in Middlesex-London based on the local data?
Well, I'll start with the data question first. I just reflect on where we were last summer. Last summer we were between 0 and 5 cases per day. We're still, 18 is way off the highs we've seen, but it's actually still a fairly significant amount of disease spread. So I certainly don't think today we are ready for a step one reopening yet. But by the 14th, I think we likely, very, very likely will be. And whether we are somewhere between now and then, I think time will tell. And there's more data that'll need to be accumulated in order to, make an appropriate judgment there. And I still agree, that if we had more vaccine here, we could provide more coverage for our population, and that would be better for the health of the people in this area. The Delta variant seems to have, be susceptible to the vaccine, but it looks like, and again, data is still gathering on this, but it looks like 2 doses are even more important for the Delta variant that came out of India than for other variants. And so, we have a pretty limited ability to offer accelerated second doses right now. If we had more doses, we could do, we could open that up much more broadly. So yes, I think we still absolutely need more vaccine here, and we have the capacity to give it.
Thank you, Dr. Mackie. And before we go to the next question, Mayor Holder, I wonder if you'd like to comment on those questions as well. Oh, Mr. Mayor, sorry, you're on mute. Just get to Mayor Holder in just a moment.
There we go. Dan, there were 3 parts to that question. Just capsule those very quickly, please.
For sure. The first part, Mayor Holder, was about the AstraZeneca vaccine and booking second doses of mRNA. I never get that right. But the rest of it was given the number of Delta variants, do you still feel that Middlesex-London should be pushing for the 20,000 doses that this region has seen redirected to hotspots? And yesterday, the Premier suggested step one of reopening might start before June 14th. Do you feel an earlier start to reopening is appropriate in Middlesex-London based on local data?
Okay, I think the first question was more for Dr. Mackie, and I think that's been dealt with. On the issue of vaccines, look, one thing that encouraged me was Dr. Mackie's comments that 2,000 additional vaccine doses came in, and I think that's positive. That's still a long way off from where we feel we need to be and should be. And so from our standpoint, we will continue our speaking with senior folks within the Premier's office and also the Medical Officer of Health through Dr. Mackie and the Minister of Health through me to encourage additional vaccines, because here's the point. At one stage, you'll recall earlier on, we said we could vaccinate as many as 10,000 people today if we had the doses. What I'm sure of, though, is that this is not an issue of hoarding vaccines. We also acknowledge why it was important that hotspots get treated. And at one point, London had the hottest hotspot for a short period of time. But give us the vaccines, we'll put them in arms. We have capacity, and we're absolutely in a position that we can do that. And so the pressure will carry on, because if there are additional vaccines, then we need to ensure that we get our share. I would say at the same time, if the province has additional vaccines, they're not trying to be anti-selective to London. I don't believe that would not be, that would make zero sense. So the issue is when the vaccines come in, I think you're going to see those averages balance out. And that's certainly the expectation that I would have. And as it relates, I'm sorry, to the final question about Premier Ford and the potential for the economy to open up a little bit more, it's that balance that any political leader tries to maintain. How you protect the interests of the community and how you try to preserve the economy. And I think he's caught between a rock and a hard place on this. And I think as we have seen the provincial numbers overall, which if you recall, he set some expectations about what the numbers would have to look like to open up the economy. And I think they're trending in that way. You just have to speak with any business in London that's had the significant restrictions put on them, who indicate that they can do this carefully, thoughtfully, and in a very healthy way for their clients and customers. And I think we all have empathy there. So what you try to do is try to balance that care with economic recovery. That's tough decisions that he has to make at a global basis, and things that we deal with right here in London, Ontario. So if the numbers warrant, then I can support that. You heard the medical officer of health say, now is not yet that time. The Premier is saying now is not yet that time. But I think what we do is I think we have to take that wait and see. And every day is more promising, it seems, than the week before. And so I think it would be rash to make that judgment and offer strong opinions until we see the numbers continue to drop.
Thank you very much, Mayor Holder. Our next question comes from Andrew Graham at Global News Radio 980 CFPL. Dr. Mackie, this one's for you. Dr. Mackie, what's your take on Premier Ford wanting outdoor graduations for every grade at Ontario schools? Is it possible to do this safely? Has the health unit been consulted by local schools?
I think it's fair to say that we've just kind of begun turning our minds to this. We heard it about the same time that you did around the announcement that came earlier this week. So lots of thinking to be done there. I think it will be important to respect the gathering limits that are in place. And so I hope nobody is planning, very large gatherings that would exceed those. And then, we certainly will be working with our school board partners and with Southwestern Public Health to make sure we can give the best possible advice and support.
Thank you, Dr. Mackie. And a follow-up question from Andrew Graham. Dr. Mackie, Fanshawe College has just announced a vaccination requirement for students and residents. How reassuring is that news from a public health perspective?
It's fantastic to see both now Western and Fanshawe big props. Thank you very much, Fanshawe, for doing that. You'll really certainly prevent cases and likely outbreaks from occurring in the future by doing that. So as someone with children, I think probably most or all parents want their children to be learning in an environment that's safe and certainly living in an environment that's safer. And the vaccination will really help to get to that.
Thank you, Dr. Mackie. Mayor Holder.
Yeah, thanks very much. I think that huge credit goes to Western and Fanshawe for making this decision. Where did we see outbreaks too often in residences? And I think this is not just a preemptive decision, but the actual determination to proceed this way will save lives. We know that it will stop the spread. And I look forward to the time when, and soon, that every student at Fanshawe and Western get the shot and get the second shot.
Thank you very much, Mayor Holder. And to those in attendance this afternoon on the media side, if you have a question that you've been waiting to ask, now would be a time to get it in. We are getting down to the last few questions. So remember, just click on the text bubble with the question mark and indicate who your question is for. Our next question comes from Jennifer Beeman. Dr. Mackie, if the 80-plus crowd seeks out an earlier second shot at pharmacies, are you worried people will not cancel their scheduled second doses at mass vaccination sites? Will this hamper the rollout?
Yeah, so that is a potential challenge. We do not encourage people to seek vaccine at a different location. And we would really ask that any of those pharmacy partners who are offering second doses to those who've been vaccinated elsewhere, please make sure that that second appointment gets canceled either through our phone lines or however you can.
Thank you. Craig Needles from Blackburn News is joining us this afternoon, and he has a question for you, Dr. Mackie. With the province's decision to keep schools closed the rest of the year being finalized this week, what data will you be watching for when it comes time to open schools in the fall? Will students need 2 doses for school to be back to normal?
Yeah, appreciate the question, Craig. You know, we're seeing good uptake in young people, and we expect that to continue and expand over the summer. 2 doses is really what we want students to have before schools start to get back to normal. One question that is still outstanding is whether eventually this vaccine will become part of the Immunization Schools Pupils Act, in other words, become mandatory. We don't know that yet, and I don't think that will happen by the fall, although it might. In any case, I think by the time September hits, you'll likely have a subpopulation of students that are not yet vaccinated, and so you'll likely have a lot of the precautions that we've had remain in place. I think you'll see more in-person learning in high school, I would think, but still, too early to say whether masking will be required or other adaptations to how school lunches and recesses and that sort of thing work. Still working all that out.
Thank you very much, Dr. Mackie. Let's go to our next question. Jane Sims from the London Free Press has a question for Mayor Holder. Mayor Holder, when do you plan to be speaking to the Health Minister again about redistribution of doses? Over 80s in Toronto are getting their shots while ours are still waiting. What else? What else can the community do to get more vaccine here?
Well, thanks very much, Jane. I expect to be speaking with the Minister of Health this afternoon, just to give you some clarity to that. And I think that, in a sense, addresses the second part of your question there. In terms of what can the community do to get more vaccine here? Well, the first thing I'm going to say is, if you haven't gotten your shot, get your appointment in to get your shot. That's the first thing that I think is the most critical piece. And the second part comes with the discussions that I will have with the province, and also the communications that the Medical Officer of Health has daily with the provincial medical health officials and the table that he deals with all the time. They recognize the need in London. That it's absolutely clear. The fact that some are getting their second shots. Look, I'm terribly concerned about all of us getting our first shots, and to do that, we need more vaccine. We got 2,000 additional doses beyond what would be expected this past week, and I look forward to balancing that out over the next short while. If I could define that in days, I would tell you that. I'll know better after my discussion with the minister.
Thank you very much, Mayor Holder. Well, Mayor Holder, Dr. Mackie, that does bring us to the end of our questions for this afternoon. I'd like to thank you both for your time and your information once again. And that will take care of today's briefing. We will be back on Monday, which the week has gone by very, very quickly. That will be Monday, the 7th of June, 2 p.m. You can join us then for our next virtual media briefing. So between now and next Monday, have a great weekend. Stay cool. The weather is going to get warm, and take care of each other. We'll see you next week. So long for now.